So thank you everyone on LinkedIn Live who is here with me and Dr. Swati Varanasi today. Okay, yep, I still am hearing the echo. So Swati, I'm debating the best way to follow through with this, where
I don't hear the echo on my end.
Okay, I'm wondering if it has something to do with my Zoom window open with my LinkedIn window open.
Oh, probably.
When do I? Okay, so how do I, this is where I need a VA to handle with all my technology.
I don't have LinkedIn open.
Okay, I'm gonna, if I close my LinkedIn, will that,
maybe?
Oh my gosh, thank you LinkedIn world for being patient with me. There we go, I think that worked. Swati, can you hear me?
Yes, I can.
Perfect, so I'm gonna go ahead and do that. So I muted that window. Great. So I am Dr. Danielle Plummer. I'm a pharmacist in Las Vegas with my hands in many pots. My very first thing I want to say to my first LinkedIn Live, my second attempt though, is that anything I say or do today during this time is just a reflection of me, my education, my knowledge, and not a reflection or words from any of the companies I work for. I have a full-time job I absolutely love. This has nothing to do with them, but I'm fortunate to be able to apply my knowledge as a pharmacist in these many different arenas. And me, amazing, amazing pharmacists like Dr. Swati here. And one of the other things I do on the side is a medication management program for women with extreme nausea and vomiting in pregnancy. One of the things these women ask me all the time is about CBD. So when I got to meet Swati here, you have, and I was looking on your website, you have published papers, you have done so much research, you have businesses we'll get to talk about in a minute to do with this. So I'm just so grateful for you bringing your knowledge here today and sharing it with everybody, because there's so many questions surrounding CBD and how it relates to cannabis and cannabidiol, how it works. As pharmacists, we always focus on the mechanism of how it's working, which tells us why we're going to get the end result, which tells us why it might interact with these other medications or other disease states, which helps us weigh the pros and cons of medications, right? And decide our best medication management program. So I'm hoping what we do here today, our audience will find useful.
Yes.
And just a reminder too, everything we say is not to be used as medical advice. This is for education. Please don't change anything to your medications without talking to your doctor first. So I did a brief introduction of myself. Swati, go ahead, tell everyone here in the world of LinkedIn and who's hopefully, I think around the world, we have people viewing right now, about yourself.
Yeah, absolutely. Yeah. Again, thank you so much for having me. I love having opportunities like this to talk about and address so many of the questions that I get from both patients as well as providers. And I feel like a lot of, at least from what I've seen as a healthcare professional, as a pharmacist, especially in the integrative space, is so many people want to know more about CBD and about cannabis, whether it's for themselves, for their loved ones, for their patients. But the common theme that I see is that they don't know where to look. They don't know who to trust. And like some people might even think, that there is not any research, which, as we know, both of us, that is not true. And so I really aim to be one of those people who can provide evidence-based, scientifically driven content for any and everyone who's interested in potentially incorporating cannabis or CBD into their daily life. I think it's really important to know healthcare professionals, know as in, whether it's online, people they can trust, to find that information. So it doesn't necessarily, and another thing I think that's good to mention actually is that the average healthcare professional doesn't know anything about cannabis or CBD. And so that's just important to know, because I find that sometimes patients or other healthcare professionals will be asked questions about cannabis or CBD, and they want to ensure safety and efficacy for every patient, which is incredible and what should be the case. But because they don't know a lot about CBD, they'll just say, no, don't do it. And so patients will take that as like, oh, I shouldn't, or something like that. Whereas the healthcare professional is coming from the standpoint of, I want to ensure the least amount of harm and the least amount of, potential risk for my patient. And so because they don't know about it, to them, that's the lowest amount of risk. So just because your healthcare professional says no or is scared of it, it doesn't necessarily mean they're against it because of what they know. It's just simply they don't know. So I always like to bring up information like that because I don't want people to be misled that, oh no, it's this dangerous thing. It could be great for so many people, not for everyone, but it can be great for so many people. And that didn't really answer your question now that I think about it. So
no, it's okay. It's okay.
Yeah, I was like, so to answer your question though, I'm Dr. Swathi Varanasi. I am also a pharmacist by trade. I was someone who was always interested in integrative and preventative medicine. And so right out of completing pharmacy school, I found an incredible mentor and moved out to LA, which is where I am still right now. So met her and we put together and founded the first ever residency program for pharmacists and for pharmacy students interested in pursuing this unconventional role in an integrative space. And so I helped co-found the program, and I was also the first resident. So had my training at both an independent natural pharmacy as well as a clinic setting. And then since then have worked in a myriad of different roles, but really a lot of them all come down to the importance of education of evidence-based information.
Which is so incredible because there's no FDA approved medications for severe nausea and vomiting in pregnancy. We have up to 30% of pregnant women taking on Dansetron. There's so many risks and benefits associated with that, along with any medication, not just I don't want to call out that medication because I'm a big believer in it for so many women, but is it necessary to deal with those adverse effects or those potential consequences when we have something that might be a better option or an alternate option? So where I live in Las Vegas, there is CBD sold on every corner. We have it in every gas station. We have it in every gift shop. We also have cannabis, actual marijuana shops here for those 18 and older. So, the question is, what's the difference? How does it work? You told me a really interesting history about the plant, where CBD comes from, cannabis versus hemp versus marijuana, what's going on with the Farm Act, enlighten me about different strains. I'm throwing a whole lot at you. So Swathi, let's step back for a minute and say, what is cannabis? If somebody asked you that, what would be your first response?
Yes, absolutely. So to me, like as someone who comes from an integrative space, I see the value in all herbs as well as all different modalities of health and healing. And so within that sphere, cannabis is an herb. And so it's not synthetic, it's something that's grown in the ground, and it's something that's been used medicinally for thousands of years. And by thousands of years, I think the earliest account was something like 2000 BC in China. So it's been used for thousands of years for therapeutics. And then since then, it was brought over to Europe. And then since then, it was brought over to the US in the 1800s. And it was brought over again for therapeutic value. And so it was utilized by pharmacists and apothecaries at the time, dispensed to patients, as well as by physicians who were the ones recommending it too. So it really had its, metaphorical / figurative roots in medicine. But because of a lot of the immigration that happened, in the 1900s, and also the, fear by a lot of conventional practitioners that, medicine was changing from, what they were taught in school with medications to, something completely different with the utilization of herbs. Now cannabis, as well as some other herbs too, are very racially charged. They're very controversial. And that was, because, for example, it was known as cannabis, and the genus Cannabaceae is how it was referred to for years. And then the terminology completely switched when they found that they could link, certain herbs with certain marginalized communities. And so
I
that's
didn't
why,
know any of this. So
isn't it fascinating? And it's not something that anyone talks about. So there's like, there's no reason why, the average person would know, because it's not really discussed. And so that's why it started being called marijuana, which is just like a made up term, really. It was, but the term that it was based off of is maranhua, which is the Chinese way of, the Chinese, like the traditional Chinese medicine terminology for the cannabis plant. So it was like warped and reinvented to match
wow.
what was going on in the country at the time, and what like the government and certain people and the higher ups were like really afraid of with the change of medicine.
So this is really powerful, because this was not the history. I was talking about how we name strains, but I did not see this coming. So this is really incredible, because we have such a, when we talk about history in the United States, right? I haven't seen it tied into medicine the way you just explained it. Now we tie it into medicine today when we talk about communities that, I'm trying to write the appropriate way to phrase things. Communities that maybe don't have the services for medical care as other ones do, easily at their fingertips, but it goes so much deeper and so much further. So Swati, thank you so much for bringing that to my attention. And I'm guessing most of the audience that are with us today, I was completely unaware of that. And, there's so much bias that's still going on. And today,
Exactly.
I see, and when somebody comes into the hospital, if the ER doctors think that maybe there's marijuana, I'll have women, in their system, I'll have women reaching out to me going, they drug tested me, it's in my medical record, I'm afraid my baby's gonna be taken away from me. And this does happen. And not to relate it with any ethnicity or certain population group, but it's different state by state. These are things we need to watch out. And we're going to try to remove as much bias and influence from that, so that we can do the optimal patient care with the least amount of judgment. When I have a woman reach out to me for help, I don't know their skin color, I don't know, there's so many things I don't know. They're a set of initials when I began. I love how we learned in pharmacy school, and I think the whole medical education system's the same way. When we talk about a case, we look at their initials. Now, we are going to get into ethnicity when we talk about pharmacogenetics, because how medications metabolize in different patient populations does stem from where their history is, how their genetics are. However, when we look at something like this, when we look at using cannabis, that whole history, I was just completely unaware, and something everybody should know. So thank you so much for bringing that up today.
Absolutely,
Yeah.
absolutely. And I'm thinking, like, what question should we answer next? Because there's so many like other things. So one of your other questions was, hemp versus marijuana versus cannabis versus CBD, right? So
yes,
I guess to start, so CBD is a compound that is found in the cannabis plant. And so, as I mentioned, Cannabaceae is the genus. And so that is, the overall like scientific term for the plant. And so marijuana and hemp are kinds of cannabis. And so hemp is the one that, by the 2018 Farm Bill, which also plays into a bit more recent history of cannabis, is so since the 2018 Farm Bill, which is actually the 2018 Agricultural Improvement Act, it speaks to a lot of different things, but one of the things that it speaks to is the utilization of any, industrialized hemp product. And so this is why since 2018, there's been such a spike in so many CBD brands that have come out, and especially the CBD brands that you see, on every street corner, so to speak, because of this act that now that CBD products can be really sold anywhere as long as they're hemp derived, so they're from the hemp plant. And so really what that means is that generally hemp plants have higher percentages of CBD. And so what it also means, though, is, and this is also set by the act, is that these plants, as well as the products that come from these plants, can only have a maximum of 0.3% THC in them. And so that means that, depending on what type of product a patient picks up, if they don't know the terminology, they could be picking up a product that, has up to 0.3% THC, or they could be picking up a product that has 0% THC. It just really depends on what kind of product they pick up. But that is really the maximum that's legally allowed. And so a question that I get after that is, oh, where did the 0.3% come from? Yeah, it's completely arbitrary.
Oh,
And
okay.
yeah, I know. So like there's no science that I'm aware of or anything. They just arbitrarily picked 0.3%. And if you look internationally, there's some not like, not 2018 farm bills in different countries, but like equivalent type of legislation in different places. And a lot of other countries say 0.1%, 0.2%. And so again, it's very arbitrary at this point as to how anything is being determined in that, in that 0.3% versus 0.2 THC percentage.
So I have to ask you this question based on that percentage. We talked about when you, okay, I always thought it had to do with the strains. And I said to you, and I'm so happy to have your knowledge here to update me on this. I said, I've never seen a clinical study where they've compared strains, dosage, duration, not just a CBD, but I want to see it in marijuana for pregnancy. Like, this is my dream, right? So we can say, hey, this works safely at this level. Although, risk versus benefit always, but this is just like we do for epilepsy now, right? But you said to me, we no longer go by strains. And I'm wondering if that's like that 0.3%. We don't have 100% pure grade, right? Because it's nature, it's plants, and wind blows and things change. Is that correct? Like, point me in that direction.
Yeah, so the 0.3% from the Agricultural Improvement Act is like almost in like a different, I don't want to say category, but it's almost like a different part of the discussion, because the strains conversation is because there's been so much hybridization, and I say hybridization between sativa and indica, and a lot of the time people who still like smoke recreationally and everything, they'll refer to, oh, I like indica versus sativa for this reason or that reason. But in reality, right now, there's so much hybridization between the two two types of cannabis that now there really isn't any distinction between a sativa and an indica. And so it's not really described in that type of a way. It might be described that way in your dispensary, but within the medical community, and when we're looking at, what is going to help our patient, it's not really denoted by strains anymore. And then the other thing too is that, at the end of the day, the most important thing is the profile of the plant. And the profile is everything from what cannabinoids are in there. So CBD, THC, CBN, other minor cannabinoids too, what terpenes are in it. So this is all like, different terminology that we can break down, of course. But and then also, what polyphenols are in there. There's so many different aspects of what's in a plant. And I think that's also what's very frustrating to the average healthcare professional, because I mean, at the end of the day, we're used to a drug that has one compound, right?
Yeah.
So it's just so much simpler than, having an herb that has so many different things in it. And so but it's very interesting how quickly and how, honestly, incredibly, things have shifted and changed within our, scope of what we know about cannabis. Like, I don't know if it's going to blur it out. Oh, it didn't. But this book, did it?
Oh, it did. Yeah.
Oh yeah, Cannabis Pharmacy. So this book, for example, right now I'm leading a book club and we're reading Cannabis Pharmacy. And this book was written not even that long ago, like not even like 5-7 years ago. And it was written by a pharmacist, one of the earliest, pharmacists in the space. And so this book, out of the, 200 plus pages, 80 pages are devoted to strains, because at the time we thought that strains were that important on figuring out, okay, so like if a patient is feeling this kind of way, then we'll refer to them to this type of strain. But since then, we've really realized that strains are not just, one or the other, right? Because it depends on what type of soil that they're grown in, what type of nutrients are in the soil. It also depends on the wind blowing, like so many different things, right? So we can't just say it's one strain versus another anymore. But really it's down to the testing that's done per each, batch of the plants, so that we're able to see, okay, these are what's actually in the plant. And then we can look to the research to see, okay, what compounds have research that speak to XYZ disease state. And then from there, we can figure out which plant is right, but it doesn't just, unfortunately, it's not as simple as just the name. Yeah.
And that amazed me. And I think that's one of the things that makes it so difficult to have a clinical study. How do we compare, right? Keeping it with CBD, if you do have that 0.3%, are you going to feel any of that psychoactive element from it, a
Yeah.
response from that?
Yeah. So, okay. So first, let's break down psychoactive. So psychoactive is also a term that's not really being used anymore in the space.
Okay.
And that,
This is why I need you here, right?
no, but that's it, I still see it all over the place. But in like within like the, the medical community that's in cannabis, it's not really used much anymore. And that's simply because psychoactive means, as we both know, it just means that it's active in the brain. And many cannabinoids are active in the brain. So
Yes.
THC is not the only one that's active in the brain. So instead, it's being akin more to like the way that we describe alcohol. So alcohol being intoxicating. And so THC is now being described as like intoxicating for the brain rather than psychoactive. So that's the first thing. But with the 0.3%, see, this is the thing. It depends on the person. Some people, it's possible just simply because of the way physiologically that THC works in the body. It's possible. I think it's very, very low likelihood and rare, but it's still possible, which is why, if someone has a government job and they're getting randomly drug tested, or, some pharmacy schools and medical schools now are randomly drug testing. So it's important to know that even if you're picking up a CBD product, that if there is that 0.3% in there, then it is possible it could show up on a drug test, because conventional drug tests are testing for THC, not for CBD. So it's possible. So if that person, for example, were to come to me and say, I'm interested in using CBD, what type of product should I get? I'm afraid of, failing a drug test. Then really what I would say is either a CBD isolate product or a broad spectrum product. And again, so much terminology. So let's break down what that means. So the full spectrum product. So it's really important when you see like I was going to say this is not a CBD product, but I happen to have like a bottle here. So I was like, if you do see a bottle or anything and you see like something, that says full spectrum, that full spectrum means that as per the 2018 Farm Bill, that there is that up to 0.3% of THC in it. So for someone in this scenario, I would not recommend a full spectrum product just for the chance and possibility that they could fail a drug test. Not saying that they will, not saying that they won't, but it's just a chance. So I would always say no full spectrum for them. Then the next one down from there is broad spectrum. So broad spectrum means that it has everything in the cannabis plant, much like THC, except much like THC, much like full spectrum, but there's no THC in it. And so that could be an option for someone who is, afraid of a drug test, but still wants to see if, they can get medicinal benefit out of CBD and other aspects of the plant. So that would be a great option, broad spectrum. Then the other thing is CBD Isolate. So CBD Isolate is exactly how it sounds. It's just isolated CBD from the plant, and there should be nothing else in it. I say should be because a lot of brands don't do the right testing. And it's really, really important that there's third-party testing from CGMP Standard Labs, Standard Labs. And that's very important because we need to ensure that, the products that we're recommending for patients have, I would argue multiple rounds of testing. Our company does 3 to 4 rounds of testing per batch. So it depends on, what people want and what people want to recommend their patients, right? So the most important to me is transparency and the opportunity to see what is in each of these products. And thankfully, because of all the testing is like public documentation. So every company should be forthcoming with exactly what's in every single batch of product, because legally they should. I guess no company has to, I suppose. But the documentation is like a legal document that anyone could have access to. So for example, if you're considering, buying from a brand and you don't see it's called the certificate of analysis. It's their entire lab report of everything that's been looked into. So if they don't have that posted on the website, some companies don't. That doesn't mean they're a bad company. They're just maybe looking for aesthetics on the website and they don't want it to look clunky, which is fine. However, if before you buy from any company, you should reach out to them and see if they can provide you the COA if it's not listed. If they say, some, questionable answer that like, oh, we're not allowed to disclose it, or we can't send it to you, or they never respond, then to me, that means that they didn't do the appropriate testing, and then you shouldn't trust them.
Mm-hmm.
Yeah.
And it's incredible. I'm really fortunate to have this community, Swati, pharmacists like you. I have one, I'm just reaching out to me. I did a blog on recommended products. And when I work with pregnant women, a lot of them can't take that chance at all of anything showing up in a drug test, right? So that 0% is really important. I know David with Viseo and Daniel H., one of my colleagues here in Las Vegas, who's a pharmacist and is involved with it. They like, that's the first thing to do. We have our scientific director, we'll share that information with you, that certificate. And I know your company, and I want to get into what you offer as well. I have Laura messaging me now, another expert with this. So we'll do more talks on that in the future as far as what does CGMP stand for? Like, how do you know a product's authentic? Because going back to what I said earlier, CBD sold on every corner where I live. How do you know what you're getting, where the ingredients, even the inactive ingredients, where are they coming from? What's the best formulation?
That's
right?
Like the scariest thing to me,
right?
And even to see like at a gas station that there's CBD, like what kind of standards, and like it's just, man, it's and I feel like because it's now everywhere, it's like I think that adds to the level of distrust that people have. It's not helping, I don't think. I think it's now people are like, wow, it's just on every street corner, then like, can we trust it at all?
Right.
And so I think it's almost counteracting what they're trying to do, which is say, CBD is safe for everyone, which I also don't agree with at all. I think that there are certain populations that we absolutely should not consider CBD as an option. And that could be because of, a certain disease state, but that could also be, because of a medication that they're taking. And then I would not recommend CBD for that person. So it's just so multifactorial as to why I really don't think that CBD should be on every street corner. Yeah.
Amazing, right? Okay, so let's back that up a step. We're talking about, okay, so those who are not pharmacists that are with us today or in the medical community, we always look at the targets, the receptors in the body. When we put something on our skin or we ingest something in one form or put it into our veins, right? What's going to happen? What's the response when that medication or ingredient gets to the receptor, the target in the body? So when we talk about CBD, how is that working? Where is that going in us? Because they're cannabidiol receptors. Am I saying it right?
So they're so they're considered CB1 and CB2. So they're cannabinoid type receptor 1 and cannabinoid type receptor 2. Those are the two receptors that we know the most about. And those are the receptors that are directly associated with the endocannabinoid system. And so even healthcare professionals listening right now are probably like, what is that system? Because unfortunately, we didn't learn about it in school. And now slowly but surely, I hear that, some schools are starting to include it. And I've given some guest lectures where people want to include it, which is really exciting. However, it's still not the standard to have that as a part of our curriculum yet. It will be. And so, so those are the two receptors. So it's CB1 and CB2. So cannabinoid type receptor 1, cannabinoid type receptor 2. Those are the two receptors. And so those receptors work with the endocannabinoid system. The endocannabinoid system is, those two receptors that are found throughout almost every organ system in the body, which is really incredible. And so it's not like, for example, the cardiovascular system that's very much, concentrated in a few organs. This one actually really is indirectly linked with so many different systems in the body, whether it's organ systems or neurotransmitter systems, simply because they are found in so many places throughout the body. And so The CB1 receptor in particular is most closely associated with like central nervous system and peripheral nervous system function, whereas CB2 receptors are found in various organs that have more to do with immune function. And so that's what we know right now. I'm like, at this point, like we're certain that there are more cannabinoid receptors. We just don't have the research enough to really talk about them yet. But more research to come, more exciting news to come, I'm sure. Just at the moment, that's what we know. And so it's very fascinating though, because CBD doesn't just work on the endocannabinoid system, as well as a lot of other cannabinoids too. And I say this because, you know, as I mentioned, the cannabinoid receptors are found throughout the body. And so because they're found throughout the body, it's also possible that cannabinoids that we ingest, like CBD and THC, can also work on other systems. And so CBD in particular, the research shows that it actually doesn't bind to CB1 or CB2, but it modulates the endocannabinoid system. And the goal of the endocannabinoid system, which I don't think I said yet, is to maintain homeostasis or balance in the body. And so because it, you know, can influence so many organ systems, its overall goal really is to try to promote balance and try to promote like an overall what's called like endocannabinoid tone. And endocannabinoid tone is the functionality of the endocannabinoid system. So is it functioning well? Is it optimizing with other systems? Is it functioning in the way that we want it to have optimal function throughout our body? So yeah, I mean, that's what's like one of the more fascinating things about CBD. There are many fascinating things. One of the more fascinating things is that it actually doesn't bind to any of the receptors that are, you know, actually in the endocannabinoid system, but it modulates the overall tone of the system. And then the other thing is that we know from research that it does work directly with other what are called, you know, non-cannabinoid receptors. And so these are, you know, not cannabinoid receptors, of course, but they're receptors that are found in other parts of the body that work directly or indirectly with the system. And so an example of that is TRPV1, which there's a very high concentration of that type of receptor in the skin. And so that is why, you know, topical products that have CBD in them tend to work very well, because CBD has a very high affinity for those receptors.
That's the most important thing for my audience, my patients, because they cannot keep anything down orally. They're always looking for topical options, and we never know about absorption. How do you prove when you put something on your skin it's actually getting to where it needs to be? So something that can modulate in the skin like that would is just phenomenal. Oh my gosh, I still have so many questions for you. This is so informative. And so I want to know, we talk about like the different disease states. So what you just mentioned with the, you know, the modulating is that we want a balanced body. And this is key for every disease state. It's when that balance goes off, right, that we have problems. And solutions in traditional modern medicine is like, let's treat that one thing that's giving you pain today. Let's treat that one spot that's hurting or that's making you not feel well mentally or physically. But when we work with CBD, what's phenomenal about it, from what I've seen the response, is it's creating that balance. It's not just working in one location or one spot. And no medication works in one location or one spot. That's where we get those adverse effects. Ideally with CBD though, we're going to get more benefits than adverse effects. Are there any adverse effects that we should be watching out for?
Yeah, so the adverse effects that are most common, I mean, if you're in the healthcare community, a way that I like to think about it is like if you're taking an antibiotic, they're kind of similar. So like nausea and vomiting, like overall like abdominal discomfort, like that, like those sorts of things. I've also heard, you know, headache or migraine. So like things like that, but it's not anything where you're going to be like reaching for like an NSAID or, you know, an Advil or something like that, because you're having those type of side effects. Like that's absolutely not the goal, because if you're having side effects like that, then maybe CBD really isn't the right choice for you. But I think a lot of that comes down to, again, like what's the person's lifestyle, and also, you know, what other medications are they taking? Because there are certain medications that to me are like 100% red flags. Like warfarin is 100% no. Someone's on warfarin, I don't care if it's like a 2 milligrams CBD, I will say no, because because as pharmacists, as healthcare professionals, it's all about benefit versus risk. And to me, the risk outweighs the benefit, or outweighs the potential benefit even, let's say. So warfarin is 100% no. There are some seizure medications as well, like anticonvulsants, that I think are also not a good fit. Clobazam is a really good example, as well as valproic acid. Those are like my main 3 that I'm like, if I see those, it is an automatic red flag. And I mean, as of course, being in the integrative space, that like I know about so many other herbs and so many other, modalities and things that I would consider for those patients that are not cannabis related.
Perfect. And okay, I'm going to ask this question, my loaded question. What do we know about CBD in pregnancy? Do we know anything? Do we have any proof one way or another?
We know very little, is what I would say, because as you know, it's very difficult to do studies within the pregnant population. And so we don't know as much as we'd like to. That being said, again, it's all about benefit versus risk. And so something, for example, like that has topical absorption is something I'd be a lot more comfortable with, simply because most of topical absorption is not going to be systemic absorption. And so like for someone who is pregnant, I would recommend something that was topical, that's something also that doesn't have any THC content. That's again, just weighing safety, benefit, and risk. I would say a product that's either isolate or broad spectrum, so has no THC, and a product that's only topical. So that could be creams, that could be lotions, or it could be patches as well.
Perfect. And I just want to always remind everybody, ask your midwife, ask your OB, talk thoroughly about your options. I just have so many women saying, this is the only thing that helped me. I've tried everything else that's been available. Everything else caused constipation, caused headaches, made my mood drop. CBD is the only thing legal out there that helped me. Please talk to your providers, because I'm just waiting to see this paperwork. I have so many colleagues that are in this space and I love it. I didn't mention like Melanie Kane's working with, she did a blog for me as well. She's working strictly with marijuana, though I think, Melanie, you have to correct me if I'm wrong. I have Emily and Rana in Israel. I know you're doing studies right now on marijuana. Let me know if you have anything on CBD as well. So I would love just to compile this. Yeah. And I know there's I think Melanie started a pharmacist cannabis association, maybe. Let's start compiling these studies, making sure every practitioner knows all these differences. All the pregnant women that reach out to me have been multiple visits to the ER. I want emergency room practitioners, whether you're an MD, a PA, an MP, an APRN, whatever you are, an RN, you're in that ER, you're working with these women. Please, let's get educated and help them, because they are just desperate for anything to restore their life, to restore that balance. And CBD is definitely one of these potentials that I just want to see. There's so many products out there. Swati, do you want to talk about the one that what your company does?
Yeah, sure. So I co-founded a company with 2 incredible people. And so we co-founded the company, and it's called Element Apothic. So it's a clean beauty and wellness brand. And so we have topical products. We just launched a patch recently, which is why I'm like, oh, I'm so excited about that. Especially for like someone who is pregnant. I think the patch could be awesome, because it's actually a CBD Isolate product, which is very surprising, because once we went through and we were testing, different variations, and everything else that we have is broad spectrum. And so we don't use THC in our products. And so going through, we were like, okay, what's going to work? What isn't going to work? And we were so amazed by how well that THC, Swati, that CBD Isolate, the patch works so well. And so, we have that. We have topical products. So we have lotions, we have balms, as well as a face serum. And then in addition, our wellness products are the ingestible ones. So they're tinctures taken sublingually or under the tongue. And so we have a few of those as well.
Okay, assuming you are not pregnant, tell us how tinctures work.
Yes. Okay, so yes. I would not recommend them for pregnancy, correct? And so how do they work? So the tincture, for example, a lot of them are oil-based. And so that's like kind of a misnomer, simply because tincture generally within the scope of traditional Chinese medicine and everything actually means alcohol-based. So
That's
they're
what I thought. Yes.
yeah,
Yep.
so they're not alcohol-based. They are yes, they're not alcohol based. They are oil based. And so ours, for example, have different oils in them, like MCT oil and hemp oil. And the oil really helps the absorption of cannabinoids simply because cannabinoids are extremely lipophilic. And so that's why, you might see on packaging or something that, like, if you're taking cannabinoids, you should eat it with like a fatty meal. And there are some medications for our, pharmacists and healthcare professionals out there that are also like that. And so that really helps with the absorption. And so you take it under the tongue. And so that sublingual absorption is much higher than if you were to take it, and just put it on your tongue, for example. And so that really helps with systemic absorption, getting it into the body and having it work quickly.
Amazing. So Swati, I know we were like, oh, we won't go an hour, we'll go half hour. And here we are 45 minutes later. So anything else you want to add? I could go on talking all day. Anyone who knows me, like, I will just keep asking questions too. Any other disease states that you think that, besides like nausea and vomiting in pregnancy, like I work with, that you think this would just be extremely beneficial?
Yeah. So most of the research has been done in anxiety and in sleep, as well as pain.
Amazing. And that's like, with the transitions of medical care in this country, trying, this opioid epidemic that we have, let's try these other options. Let's get the studies out. I want to see like a one-stop shopping for posting for the studies, and we can all Google Scholar and whatnot, but and mesh shirts our terms. But yes, let's go. Let's with the change in the Farm Act and the explosion of CBD products, so much is out there. If anyone wants to reach you, Swati, and try some of your products, how do they find you?
Yeah, so please follow me on LinkedIn. Our company is elementapothic.com. So ELEMENTAPOTHEC.com. And please follow us on LinkedIn as well.
Perfect. And for any women with nausea and vomiting in pregnancy, or have had them and want to get pregnant again, want to learn more about me or what I do, please join my free Facebook support group. It's facebook.com/HG Clinical Solutions. You can always message me here and I can direct you to that as well. And all the other women and the other pharmacists who are in this space, I just want to say thank you so much. I'm going to just keep adding my recommendations to my blog because there's so many. Swati, I know Laura's with us, like I said, today, and has amazing products. We're going to continue this conversation. Swati, you tell me where you want to go from here, because there's so much more to unpack. Thank you, everyone who took time out today to listen to us. If you found this beneficial, please forward. We'll have it in our feed to share, and reach out with questions. We're always here for you as healthcare practitioners. So I say thank you so much for dealing with my tech.
Of course.
Issues. I know what I'm doing now. Thank you, everyone.
Alrighty. Bye-bye.
Bye-bye.